Hi everyone, Dr. Harmon here. Today I'd like to talk about peri-oral rejuvenation, and that just means plastic surgery of the mouth and around the mouth. The peri-oral region consists not only of the lips, but complex soft tissue that surrounds the lips and is under the skin surrounding the lips. The specific site I'd like to talk about today is a place called the peri-oral mounds, and they're located right here. This sits just below the lower edge of the upper cheek fat compartments and just above the upper edge of the lower cheek fat compartments, and these fat compartments are what form jowls as we get older. Now the peri-oral mounds consist of very thin fat that is very poorly defined and soft tissue like the SMAS layer, which is very commonly described in facelift surgery. As we get older, the peri-oral mounds can become more full and droopy. And this is an important region because facelift surgery really does not adequately treat the peri-oral mounds. My review of the literature and discussion with colleagues has resulted in two procedures that have been talked about to treat peri-oral mounds. The first one is micro-liposuction of the peri-oral mounds. Now, there are two papers that I found in the literature talking about this, and it's basically the use of a small cannula and inserting that in the location of the peri-oral mounds to suction out some of that fat. The problem with this is, like I said before, the fat compartment is very poorly defined and thin and close to the surface of the skin, so there's a much higher risk of changes in skin color and depressions in the skin and bad scarring from lack of blood flow to the skin in the site with micro-liposuction. On top of that, it doesn't treat the drooping soft tissue that sits deep to the fat, for example, the SMAS layer. The other thing that people talk about are the use of energy-based devices like radiofrequency devices or ultrasound devices. There is no, from what I have found, peer-reviewed paper in the medical literature discussing the safety and effectiveness of the use of such devices to treat the peri-oral mounds. So I myself don't utilize either treatment techniques to treat the peri-oral mounds, and I think people should be very cautious when considering either treatment for the treatment of peri-oral mounds.